Our cardiovascular system is a closed system of tubes through which blood circulates. That is, these are the arteries which carry blood from the heart to various organs and parts of the body. These are the veins which carry blood from the organs and parts of the body back to the heart. These are the capillaries where the artery transitions into the vein and blood supply takes place. And this is the motor or pump of our vascular system, the heart. These are other complex structure and complex functions which, as you may recall, we have discussed in several previous videos, and our vascular system is filled with a certain amount of blood. You should understand that blood actually makes up about 5% of a person's body weight. Well, that's approximately, so if your weight is 90 kilograms, you divide 90 by 10 and then by 2, and you get 4.5 liters of blood. This is the amount of blood contained in the body. Moreover, blood consists of blood cells, erythrocytes, a small number of leukocytes, a bit more platelets, and blood plasma in which proteins, minerals, and electrolytes are dissolved. And blood plasma can seep through the vascular wall in either direction. Therefore, the composition, or rather, not the composition, but the amount of blood can change slightly within the vascular system, but not due to the blood cells, the erythrocytes, but because of the blood plasma. And a mandatory condition is that the vascular system must be hermetically sealed. Hermetically sealed, if the vascular system loses its seal and bleeding occurs, it leads to the fact that the blood is under a certain pressure there. And then, when the vascular system loses its seal, blood starts to flow out through that opening. In other words, when bleeding occurs due to loss of seal, I'll say right away it requires immediate stoppage. And essentially, since the blood is in a closed vascular system, a closed system, meaning it is not open to the outside environment, it is under a certain pressure there. But we need to understand that, in fact, the pressure in the vascular system is actually not constant. Firstly, because the actual amount of blood changes due to plasma seeping both into and out of the vessels, and also because the pressure inside the vessels is also determined by the condition of the muscular layer of the vessel walls themselves. And that's exactly why the state of pressure, specifically the blood pressure that we have circulating within our blood vessels, is such an important and significant factor in human life. That is, if the pressure there becomes very, very high, the vessels can burst in a certain place at a certain moment. And this will cause, well, bleeding. This can cause some kind of hemorrhage, or could even result in death for a person, for example, if the hemorrhage occurs in the brain. That's why the parameter of blood pressure is vital for the human body. Today, in this video, we'll go over how blood pressure is actually measured. Oh! In front of you is a very old Rivarocci device. You know, friends, it's called a sphygmomanometer. When I look at this device, I immediately remember that I, Dr. Holod Vladimir Miroslavovich, used to work with such devices. I used to measure blood pressure for grandmothers with this very old sphygmomanometer. Every time I see this device, I immediately remember that I'm already an old vintage doctor. Who, if you're still using this kind of device and still remember them, it's time for us to retire, because this is purely history now. What was the essence of this device? So a cuff with a rubber bulb was carefully put on the arm, specifically on the upper part of the shoulder, which could then be inflated with air. And the manometer showed to what pressure the mercury column was raised, that is, how much air was actually pumped into this particular cuff during the measurement. Moreover, the mandatory condition was that the cuff had to be inflated so much that it completely blocked the artery, the brachial artery that truly carries blood to the arm, without exception. After you had pumped in enough air to completely compress the artery, you would slowly start to release it. You would begin to let the air out of the cuff. At this point, well, what you would observe is that we used to determine it by feeling the pulse, but over time we started to use a stethoscope, checking at the bend of the elbow, and we were supposed to hear the pulsation of the artery. That is, at the moment when we have completely stopped the blood flow, the very first moment when blood starts to break through the artery compressed by the cuff, we note this on the mercury column where I record the systolic blood pressure. So let's say we pumped it up to 160, 170, and now I'm releasing it 150, 140, 130, 125 there, 120. And I can already hear feel how the first pulse wave starts to break through. This is when the systolic blood pressure is recorded, arterial pressure. The pulse wave starts to break through, and at this moment I hear a distinct tapping sound. The tapping sound, that's the artery breaking through, so to speak. The blood in the artery is forcing its way through the compressed cuff. But then I lowered the pressure further. I keep lowering it, releasing more air. And at a certain point, while listening with the stethoscope, I stop hearing that tapping sound. This means that the cuff's pressure is now so low that it no longer restricts blood flow in the artery at all. And at this point, the lower or diastolic pressure is recorded. So as I release the pressure at 110, I still hear the tapping. At 90, the tapping is still there. At 80, I stop hearing it. And that's when I record that this is the lower or diastolic pressure. A person's blood pressure is always recorded as two numbers. This is the systolic or upper pressure. This is the moment when the heart pumps blood and the blood rises through the arteries, through the aorta, through the brachial arteries. That's when I record the upper pressure. The upper pressure is also called the cardiac pressure because it reflects how forcefully the heart has pumped the blood. Then, when the heart relaxes, the blood returns to the heart but encounters an obstacle in the form of the heart valves. At this point, the lower pressure that I record indicates how much blood is present in the vessels. And the amount of blood in the vessels, the amount of blood plasma, is determined by how much salt has been removed from or remains in the blood. So to some extent, the lower pressure is determined by the condition of the kidneys. And the lower diastolic pressure when the heart relaxes during diastole is also called renal pressure. So it dropped to 80. I record that the tapping sounds have stopped, and this means that the person's blood pressure is 120 over 80. This is not the norm, don't get me wrong, these are just average values. And I can further supplement these readings with a third number. This is the pulse pressure. Pulse pressure is the difference between the upper value, 120, and the lower value, 80. I subtract 80 from 120 and see that the pulse pressure is 40 millimeters of mercury. That's where the millimeters of mercury come from. That's where these numbers come from. And now we use a device to measure blood pressure. It's called the Korotkov apparatus. Well, the Korotkov apparatus is essentially the same, except here we pump air into the cuff compresses the brachial artery, and blood stops flowing into the arm. Of course, there's ischemia in the arm, but we're not going to measure blood pressure for a long period of time. It's not dangerous if the arm goes without blood for a minute. At the same time, I place the stethoscope on the elbow crease and slowly begin to release the pressure. In this case, there is no longer a mercury column. Now there is a manometer dial that shows the pressure to which I have inflated the cuff with air. So I pumped it up to 160. I still hear the tapping. 170. I still hear the tapping. 180. No more tapping. So I inflated it until there was no more tapping. Then I slowly release the air and see that the tapping reappears at 170. Oh. Write it down. Systolic is 170. I keep releasing, and at 110, the tapping can no longer be heard. Then I record diastolic 170 to 110. We have high blood pressure. Unfortunately, what I'm showing you are just historical methods. To be honest, fewer and fewer doctors use this approach nowadays. Now there are electronic devices. A person puts the cuff on their arm the same way, presses a button, and it automatically inflates, automatically deflates, and records the result. Electronically, it records the moment when the bloodstream first breaks through the compressed artery, when the cuff stops compressing the artery, and immediately displays your upper pressure as 108 over the lower pressure of 69. Often, the pulse is also measured right away. 78, the device calculates it automatically. However, it may not be able to calculate the pulse if there are signs of atrial fibrillation, as it is very difficult to measure in that case. With atrial fibrillation, you need to listen not to the pulse. So guys, keep in mind that with arrhythmias, it's hard to calculate automatically. In those cases, you need to count the pulse by listening to the heartbeat with a stethoscope. Well, I got a bit sidetracked from the topic of hypertension. So let's go over a few points related to blood pressure, to the normal blood pressure values that people have. All right, look. There is no such thing as a normal blood pressure of 120 over 80. There isn't. That's nonsense. That's just an average blood pressure. People have just memorized this number, but it's nonsense. Or like they say, like an astronaut, what does like an astronaut have to do with anything? The goal for strong individuals who were sent into space was not to have a blood pressure of 120/80, but rather to have blood pressure that reacted less to changes in environmental parameters, atmospheric pressure, physical exertion, and fluctuations in temperature and humidity. That's what astronauts' blood pressure means, not just 120/80. Normal blood pressure cannot be a single number. After all, there can be a range among people. That's why normal blood pressure is defined by parameters that have both lower and upper limits. And so systolic or upper blood pressure is always considered normal from 100 at the low end up to 140 at the high end. So if a person's reading is 100, 110, 120, 130, 135, or 138, that's all normal blood pressure up to 140. But anything above 140 is considered high blood pressure. Anything below 100 is considered low blood pressure. The lower diastolic pressure has its own normal range from 60 to 90. So if your pressure is below 60/50, 55, that's low blood pressure, that's hypotension. If your pressure is above 90, say, for example, 130/100 or over 100, that means the lower diastolic pressure is already elevated. Since this is related to the kidneys, you need to pay attention to the condition of your kidneys and how well they are clearing salts from your blood. Moreover, blood pressure does not depend on age. From 15 to 90 years old, this is considered the normal range for blood pressure. Yes, children have completely different blood pressure parameters. I won't be discussing those with you right now. We don't need that for the time being. We're talking about adults, and this applies regardless of individual differences. It's nonsense when someone says, for me, 150/100 is my normal working blood pressure. Nonsense, complete and utter. Because this simply means that the human body has adapted to living in a disease state, and that's why it isn't felt or doesn't show any symptoms. By the way, that's actually very bad. Usually, an increase in blood pressure is felt by a person as headaches, heaviness in the head, a pounding sensation, sympathetic symptoms related to the heart, like palpitations, sometimes arrhythmia, sometimes a feeling of pounding or fullness. Well, there are various signs. We'll be talking about this as well in the next videos. But when a person doesn't even feel high blood pressure, that's a very, very unfortunate situation, because already the person has gotten used to living with high blood pressure numbers for a long time. In that case, there's a high risk of experiencing vascular catastrophes like heart attacks or strokes. That's why, friends, today we're looking at this green area. This is the normal range. 100, 140, 60, 90, these are considered normal values. Sometimes when I talk to people and ask what normal blood pressure is, considering that we're fighting hypertension, I always say the norm is 140/90. 140/90. In other words, this is the concept of normal, where we determine whether we are still within the normal range or have already crossed the line. And that's why a systolic pressure 140/90 is considered normal. Lower blood pressure of 100 to 60 is normal. And everything within these limits is considered normal, regardless of how a person feels. Because if you feel unwell, but your blood pressure is within the normal range, then it's not hypertension or hypotension, but rather vegetative vascular dystonia. And that is a completely different condition, and it is treated differently. But friends, as for what hypertension is, how it manifests, and why it is dangerous, I think we will talk about that in the next video. That's all for today. Stay tuned to the Dr. Golod Health Academy channel. We will continue to discuss the topic of hypertension and, in general, cardiovascular diseases for some time. Well, for today, I say goodbye to you. As always, I remain your doctor, Volodymyr Maroslavovich Holod.